Welcome to the Barton Joint Replacement Pre-Surgical class. Thank you for taking the time to attend. I'm Madonna Doyle and I'm the nurse navigator that'll be here to help you through your navigation of getting your joint replacement. And I'm here to help you through the process of having your shoulder replaced. Today, we're going to go over some general information, preparing for your surgery, understanding your surgery, the hospital expectations, your rehabilitation, and your recovery at home. Our goal is to get you back to the activities and lifestyle that you're used to as quickly, but also as safely as possible. From this slide, basically you want to make sure that you have any of your throw rugs out of the way, that you have your electrical cords moved, and you want to make sure that animals aren't in the way. For showering after surgery, you want to make sure that you cover your dressing, and you just want to have a safe place to shower. I do recommend sitting down for about a week after surgery when you're showering, just so that you don't get lightheaded in the shower and you could fall. So through our joint replacement program at Barton Hospital, you will be getting a call from the pre-admit office. They'll get your surgical and medical history and your list of your medication. After they share that information with the anesthesiologist, they will let you know what blood tests that you need to have. Most people over the age of 50 also need an EKG, and some people need X-ray. And if you have cardiac history or symptoms, you'll need to get a stress test. Most patients need to get clearance from their primary care provider, so it's important that you make an appointment as soon as possible to get that clearance. Some people also need to see cardiologists or other specialists. The pre-op office coordinator, as I said, goes over your medication. They also go over medications to stop. 2 weeks prior, no vitamins, minerals, herbal or nutritional supplements. 1 week prior, no aspirin, Motrin, ibuprofen, or other NSAIDs. It is okay to take Tylenol. They'll also let you know what medications you'll take on the day of surgery. And then I sign you up with the CareSend texts and emails, and you will get a text and email to remind you. It's really important to be in your best possible health before surgery. It lessens your chance of complications, shortens your recovery time. So stopping smoking, as it affects the blood circulation and it delays healing and slows recovery. Making sure that you're getting a well-balanced diet, keeping yourself hydrated, and no alcohol 24 hours prior. You will be having 3 showers with the special solution. 3 times before your surgery. It's important to get that shower kit from your doctor's office. If you did not get that, then make sure that you give me a call and I'll work out how you can pick one up. When you're having your shoulder surgery, you're going to shower like you would normally shower, and that's on the 2 nights before surgery. And then you're going to get a third of the special solution, and you're going to lather the top part of your shoulder. Then turn the washcloth over and you lather the armpit underneath. The water is not running during this time when you're lathering, and you do not want to go back up to the top of your shoulder. After you've done your underarm, then you want to do the rest of your body. And that'll be 2 nights before, the night before your surgery, and the morning of your surgery. Do not shave your armpits or any part of your body below your neckline at least 2 days before starting those showers. You'll do the 3 chlorhexidine showers like I've just described. Then you'll use a clean towel after your shower. No lotions, potions, or perfume deodorant after the showers. Put on clean sheets on your bed after the first shower. and avoid having pets on the bed after you start the showers. Bring your glasses, loose fitting shoes, comfortable clothes that you can wear. You will have a sling. So actually a big t-shirt is a good idea. That will go over your surgery arm and then pulled over your head and then pull through your non-surgical arm. You can wear button-up shirts, but they also, it is difficult to do them up with one hand. Please do not bring any jewelry, do not bring any of your medications, and do not bring any money to the hospital. The surgeon, if there's any change in your condition, illness or injury, days before the surgery, make sure you let your surgeon know. If you become ill the night before, just reach out to the main hospital number at Barton and ask for the nursing supervisor and let them know that you have a fever, chills, diarrhea, or anything like that. So we started our showers 2 nights before surgery. Then you do your second shower. And then that night, there's nothing to eat after midnight. And you can have clear liquids up to 2 hours prior to your arrival to the hospital. They will not tell you the time of the surgery until the day before. So before the surgery. So as soon as they tell you the time, you want to think back 2 hours, and that's the time that you can have clear liquids too. We also recommend you having 16 ounces of blue or white Gatorade 2 hours prior to your arrival to the hospital. If you have diabetes, we recommend G2. It has about a third of the sugar. It's to do, the Gatorade is to do with carbo loading. And it helps to keep your blood sugars more stable, to do with the insulin sensitivity and resistance. This is a recommendation, although it does improve wound healing, it decreases anxiety, decreases your chance of getting nausea and vomiting. So we do highly recommend taking the Gatorade, and please reach out to me if you have any questions about that. You take your medications like you were instructed, brush your teeth, rinse and spit, and then no smoking or drinking at least 24 hours prior to surgery. As I said, the surgery times can be subject to change, so that's why we tend not to give you the time until the day before. And then don't wear any glasses on the day of surgery. So this is beautiful Barton Hospital in the springtime. You would come to the main entrance of the hospital. And then you will report to the surgical desk in the front lobby, or actually now it is at the front desk. During COVID, a lot of things have changed, and so some of the process may change from time to time. Once you get in, they'll activate your account. They'll put the identification band on your wrist. They'll take you back to the ambulatory care where they'll introduce you to the staff, do your height and weight, change you into a surgical gown, give you a little pre-op cocktail of some medications that help to manage your pain during surgery, and they'll be confirming your identity, your surgery, and your surgical site. We also use the 2-patient identifier for name and date of birth throughout your hospital stay. They'll have you brush the teeth, maybe go to the bathroom, and then they will also review medical and surgical history. You'll get a chance to meet with your anesthesiologist. You'll get an antibiotic or two. They'll give you some medication to help you sleep. With the shoulder replacement, they'll give you a interscalene block before the surgery. The local anesthetic that's used in the block blocks the nerves that transmit the feeling to your shoulder and provide excellent pain relief during your replacement surgery. And that usually lasts about 24 hours. They also use a medication we call joint juice. It's a mixture of morphine, toradol, local anesthetic, and epinephrine, and that's placed in and around the joint after surgery. So this is the anatomy of a normal shoulder. And this is what is considered a total shoulder. It's also called anatomic. Or you could get a reverse shoulder where the cup is replaced with a cap, and this cap is replaced with a cup. That's the total reverse shoulder. So again, you can see with the total shoulder, the ball is replaced and a cup is inserted. With the reverse, they put a ball at the top and they make your humerus with a cup to hold the ball. The total shoulder and the reverse shoulder with an X-ray.
The shoulder is vulnerable to stress, injury, and arthritis. The problem occurs when the cartilage on the shoulder bones wears away and painful bone-on-bone rubbing occurs. Symptoms include shoulder pain, loss of motion, and crepitation, which is noises from the joint. Surgery is recommended when non-surgical treatments fail. The total shoulder replacement surgery replaces all or part of the shoulder joint, relieving pain and restoring movement. Let's take a look at a total shoulder replacement surgery. To begin, you will be seated in a reclined position for the surgery. The surgeon makes an incision approximately 6 inches long on the front of the shoulder. This allows the surgeon to access the joint and view the damaged cartilage. The damaged head of the arm, called the humerus, is removed, and the humerus is prepared for the implant. The bone socket is then exposed and damaged cartilage removed. A hole is made for the implant to fit in. The implant is then cemented into place, and the arm implant is then inserted. The surgeon then decides whether or not to cement it into place. The wound is then closed. The surgeon sutures the incision in the skin and applies a soft dressing. Following surgery, you will wear an arm sling for support.
In this video, we will demonstrate a reverse total shoulder replacement for rotator cuff failure with wear and tear arthritis using a reverse shoulder replacement system. The rotator cuff is a group of muscles that are responsible for helping move the shoulder. When they are damaged and not reparable, loss of function occurs at the ball and socket joint of the shoulder, causing pain and dysfunction. The shoulder joint, or the glenohumeral joint, is between the head of the humerus and the glenoid cavity. The most reliable surgical option to relieve pain is a special replacement that switches the ball out with a socket and the socket out with a ball, also called reverse shoulder replacement. The surgeon uses a series of instrumentation to place guides around the shoulder to prepare the humerus. Once the guides are in place, the surgeon removes the damaged area with a saw. A metal plate is placed on the cut surface to determine the appropriately sized implant and to protect the bone during socket preparation. Attention is then placed on preparing the socket. A series of instruments is used to mold the socket into the shape of the implant that will be secured to the bone. The size of this implant is based on the patient's anatomy. A flat metal plate is secured to the socket with 3 screws. Remaining bone and soft tissue from around the plate is removed. A trial implant is placed on the plate to determine the proper size and fit. The metal plate on the humerus is removed and final preparation of the humerus is initiated. Final humerus preparation is carried out by placing a series of instruments down the canal in the bone to determine proper implant size and angle. Once the size has been determined, part of the bone is removed and smoothed out in order to place a trial implant. After the trial implant is in place, the surgeon places the socket onto the ball and assesses the stability of the joint with the implants chosen. After appropriate sizing, tension, and stability are determined, the surgeon will then remove the trial implants on both sides of the joint. Finally, the real replacement will be implanted with a ball on the metal plate and a socket that is attached to a stem that is placed into the humerus. This completes the reverse total shoulder replacement.
Okay. After the surgery, you'll wake up in the post anesthesia care unit, PACU, or the recovery. You'll have the oxygen mask on your face. You'll have the blood pressure cuff on your arm. You'll have a pulse oximetry on your finger, an IV in your arm. You'll have the surgical dressing and then ice as well. You may have the SCDs on your leg. You won't have a catheter and you won't have a drain. You will have this shoulder immobilizer in place for a few weeks after both reverse and total shoulder. And occupational therapy will review with you any exercises that you need to do. And there is a little insert video that we'll be including for you to watch. You'll receive some pain medications if necessary, but a lot of the time with that block that lasts about 24 hours, patients don't really have any pain. Once that starts to wake up, you'll have some little some tingling in your fingers and pins and needles, and then you'll know that that will be starting to wear off. The surgeon will notify your family that everything was okay. You'll usually stay in the recovery area for about an hour, and then if you're going to be staying overnight, you'll go up to the orthopedic floor. If you're going to go home same day, you'll stay there a little bit longer and usually discharge from PACU or recovery. If you stay overnight, you'll go up to the orthopedic floor, get acquainted to the floor. They'll be doing vital signs, check your circulation, look at your surgical site, help to manage your pain after the block wears off. And usually you'll go home between, we have scheduled discharge times of 11, 1 or 2, but usually 11 o'clock is the time that most people are able to go home. We do use the pain scale to assess your pain. And we also want to establish a comfort goal. So you want to kind of think right now what number you can kind of tolerate. And then that would be your comfort goal. And then beyond that, you can see things in the yellow: interrupt some activity, focus of attention. Number 7, prevents you doing daily activities. 8, awful, hard to stop doing anything. Usually patients will go home on oxycodone, which I'll talk about. And what we often say is you'll take 1 tablet if you have pain between 4 and 6. And then if you have pain 7 to 10, then you would take 2 tablets. You're only allowed to get discharged with about 5 days of medication per state laws. And so you want to discuss with me if you have any questions about managing your pain. We want to manage your pain so that you can move around, get in and out of bed, rest soundly. You'll be using some ice packs to also help manage your pain, and it's going to be your responsibility to request pain medication while you're in the hospital for only moderate to severe pain. But once you go home, you will be taking the medication. So, to prevent complications, these are the medications that you usually get sent home with. Most surgeons So you'll either be sent home with, you will be sent home with a blood thinner, usually 81 milligrams or 325 milligrams, and that's taken twice a day. In reality, that is the only thing that you need to take after the shoulder surgery. But to help to manage your pain, you can take 2 tablets every 3 times a day. We often give out Celebrex, which is an anti-inflammatory to help manage your pain. And that medication can be a little bit expensive, and I do have coupons. So if you get to the pharmacy and you find that it costs a lot, you can be in contact with me and I can send you a coupon. Oxycodone is the pain medication. And again, you take that only for moderate to severe pain. So usually 1 tablet for moderate pain and 2 tablets for severe pain. Opioid-induced constipation from the oxycodone is a real thing. Constipation is more painful than what your shoulder would be. So you want to make sure that you're also getting these over-the-counter medications, Senna and Colace. So in all, you'll be going home with 4 over-the-counter medication and then just a prescription for the oxycodone and then maybe the Celebrex and maybe an anti-nausea medication as well. So you need to make sure that you're also getting the over-the-counter medications to help with a smooth recovery. I will give you this sheet, discharge brochure. On the right-hand side here, I will go over what you're taking for a blood thinner, what you're taking for pain medication, and the things to help prevent constipation. There's also a section on how to manage your pain. Physical therapy won't usually be started until after you see the surgeon, and then I usually set up a post-op appointment for you. And then on the back of the brochure, things that you need to do every day. While you're taking the blood thinner, you usually don't take any Motrin, ibuprofen, Aleve, Advil, or things like that. Once you go off the blood thinner, then you can take those. This is the area where everything is good. This is where you need to call someone, particularly the doctor. And please just go to the emergency room if you have shortness of breath or chest pain, or your surgeon has instructed you to go to the emergency room. So we really encourage early mobilization. It's really going to decrease your risk of getting a blood clot, decrease your risk of getting pneumonia. It kind of helps to decrease your pain because you're getting up and moving around and helps with urinary retention. When you get the block, it can also cause a little bit of shallower breathing. And so it is really important to get up and move around. If you need nausea medication, the doctor will send you home with them. Again, for constipation, Senna and Colace, I cannot stress how important they are for your recovery and preventing opioid-induced constipation. So you can eat and drink soon after surgery, but don't go overboard, just light foods on the day of surgery. And things that we do to help prevent infection, besides all the things that they do in surgery, you're going to do your 3 showers before surgery, you'll have some antibiotics, and then we use a specialized dressing that will stay on there for 5 to 7 days. Preventing pneumonia, you'll have that incentive spirometer they'll give you while you're in hospital. We have you brush your teeth 4 times a day and then get up and move around quickly. To prevent blood clots, get up and move around. You can see a common theme there, how good it is for you. You're going to do some foot pumps, and then you'll wear some of those compression devices while you're in the hospital. So we will have you watch the occupational therapy video before you go into the hospital, and then you can use that as a reference after you go home. You'll be wearing that mobilizer at home, and definitely when you go out of the house. There may be times that if you're just sitting in a chair, that you might be able to take it off for a little while. And then physical therapy won't really start until after you see your surgeon at the first visit. Occupational therapist will see you. They look after activities of daily living. So they'll go over how to get dressed and undressed, bathing, and any adaptive devices. And if you do stay in hospital, you'll just usually be seen once. If you are same day surgery, usually they'll come down to recovery and go over some of the information with you. Everyone's expected to go home after one day. If there is anything that the case manager can coordinate for you for your discharge needs, we will look at that. And then it is your responsibility to organize transportation home after your surgery. So with the medications, we'll give you that list like we discussed. The discharging nurse will also go over all your medications. But if you have any side effects of those medications, please do not hesitate to let your surgeon know. So with that wound, you'll have that dressing on there. You don't want to get it wet. You'll have to put saran wrap or cling film or something like that over that. Or if you have a handheld shower, you can just kind of do the lower part of your body. You do want to make sure that you keep the under your arm clean. And then you don't want to be spreading those germs, anywhere near that dressing. The dressing is good for 5 to 7 days, and so most times you will see the doctor usually within 7 days after surgery. So you can leave it in place, but I will give you a spare one just in case. So as time goes on, 2, 3, a month after, if you notice any signs of infection, redness, tenderness, do not hesitate to let your doctor know. If you have a persistent fever or your dressing smells bad or there's any pus, definitely let your surgeon know. And then blood clots, continue to prevent them at home. Continue to do your leg exercise, to do exercises, foot pump exercises in particular, and then just don't sit for long periods of time. How would you know if you had a clot in your leg? You might have some pain in your calf, swelling, tenderness, and then definitely if you have shortness of breath or chest pain, you need to go to the emergency room. It's normal to have some swelling for sure in your arm. And most times you wouldn't get the clot in your arm area. It's usually in your lower extremity, but it is possible. So if you have any excessive swelling in the arm or redness, definitely, contact your surgeon. So overall, we just want you to be in the best possible health before your surgery. We want to prevent any complications. So, reaching out to your doctor or myself, try to go into the whole procedure less anxious, although it is difficult because you are having a major surgery. Stay well hydrated, declutter your house and get prepared and get any of your over the counter medications. So we want you to be part of the decision making process. So if you have any questions about your upcoming surgery, it's really important to reach out to the doctor because you should be a part of the shared decision making for your surgery. Again, our goal is to get you back to the activities and lifestyle that you're used to as quickly but as safely as possible. And congratulations on getting your new joint. Again, I am Madonna Doyle, and I am the nurse navigator with the joint replacement program. And so if you have any questions, again, please don't hesitate to reach out to me. We want you to have a great experience. And again, congratulations.